Hi, my name is Nora Kearns, and I'm presenting my research on the influence of prenatal inflammation on postnatal maternal and infant behavior. With the rise in obesity and overweight, an increasingly common risk factor during pregnancy is maternal BMI. Today, over half of women begin their pregnancies either overweight or obese. And while the immediate risks that obesity poses on the health of mother and child are recognized, risks like gestational hypertension, diabetes, and labor complications, less is known about the lasting implications of maternal metabolic state and the in utero environment characteristic of obesity on maternal and child long-term health outcomes. Obesity is characterized by chronic systemic low-grade inflammation. Such inflammation is increasingly recognized as a contributor to psychological illness, such as anxiety and depression. And inflammation provides a biological mechanism underlying obesity's influence on mental health. So the questions that we're interested in exploring are how maternal gestational inflammation, characterized by levels of inflammatory cytokines and pro and anti-inflammatory fatty acids, influences postnatal maternal and infant behavior. A major reason which drives our need to understand the influence of chronic systemic low-grade inflammation on mother and child mental health is our knowledge of maternal immune activation. Acute, severe inflammation in the mother, which would occur in response to a pathogen, has been linked to autism spectrum disorder and schizophrenia. These immune challenges, which are characterized by elevated levels of pro-inflammatory cytokines, can exert detrimental effects at various time points. We know that the fetus in early development is incredibly sensitive to its environment, so inflammation in the mother can affect the development of neural circuitry and synaptic plasticity in the fetus at critical developmental time points. And of particular interest to us is the fact that many inflammatory cytokines play a role in regulating neurotransmitters involved in the regulation of mood, including the 5-HT system. So pro-inflammatory cytokines like IL-6 and TNF-alpha have been shown in animal models to reduce survival of 5-HT neurons. IL-6 and TNF-alpha activate a metabolic pathway which has the same metabolic precursor, tryptophan, as the serotonin synthesis pathway. Activation of the kynurenine pathway effectively steals tryptophan, which would have otherwise been destined for serotonin synthesis. This results in reduced serotonin neurotransmission and subsequent alterations in mood. Reduced 5-HT is also associated with anxiety, depression, autism, and ADHD. However, it's believed that PUFAs, polyunsaturated fatty acids, like omega-3 fatty acids, may play a protective role. Omega-3s are recognized for their ability to reduce inflammation and decrease the levels of inflammatory cytokines secreted by immune cells. Rodent studies have demonstrated that maternal immune activation exposed mice fed a PUFA-enriched diet experienced none of the consequences of maternal immune activation, while those fed a standard diet display elevated anxiety. Rodent research also shows that omega-3 adequate mice exhibit more nurturing behaviors than their omega-3 deficient counterparts, who are more likely to attack or fail to nurse their young. So we want to see if this anti-inflammatory effect can translate to more positive maternal behavior and child development. The data from this research comes from a pilot study conducted by Eleanor Sullivan's team at OHSU, in which 62 women were recruited, 33 of whom had ADHD, which allowed us to also study relationships between inflammation and ADHD in mother and child. Maternal pre-pregnancy BMI was obtained from medical records, and maternal inflammatory state was assessed using plasma fatty acid and cytokine levels from second and third trimester blood draws. We assessed levels of 3 inflammatory cytokines, interleukin-6, tumor necrosis factor alpha, and monocyte chemoattractant protein 1, as well as anti-inflammatory fatty acids and the anti-inflammatory cytokine IL-6. We looked at many different PUFAs, but I will broadly categorize these into omega-6 and omega-3s. To assess maternal and infant behavior, a variety of tasks were performed at postnatal time points. I focused in my research on the mother-child free play, in which the mother was asked to join her child on the floor for 10 minutes of play as she would given a normal day. Using a well-validated coding scheme, mothers were scored from 1 to 5 on sensitivity, intrusiveness, detachment, positive regard, negative regard, animation, and stimulation of cognitive development. Infants were scored on positive mood, negative mood, activity, sustained attention, and dyadic mutuality. We observed expected correlations between inflammatory cytokines and BMI, seeing that mothers with higher BMIs had high levels of all three cytokines. A latent variable representing total inflammatory cytokine profile in the second and third trimester, Cyte3, demonstrates that BMI was consistently and strongly correlated with inflammatory cytokines. Mothers with higher BMIs also demonstrated lower levels of the anti-inflammatory fatty acids, the omega-3s. They also showed a lower omega-3 to 6 ratio, higher omega-6 levels, and a higher O6 to 3 ratio, as would be expected. And they were also less likely to supplement with a fatty acid. We also observed many correlations between omega-3s and maternal behavior, so there's a lot to look at here, but I will turn our attention to what I feel are the most significant and interesting findings. Consistently, we observed that omega-3s were correlated with positive maternal behavior like sensitivity, composite sensitivity, positive regard, and animation. Composite sensitivity is a latent variable combining the scores of positive maternal behaviors. Also, importantly, fatty acid supplementation was correlated with sensitivity and negatively correlated with harsh intrusiveness and negative regard. We saw a less robust correlation between inflammatory cytokines and maternal behavior, though interleukin-10, which is an anti-inflammatory cytokine, was positively correlated with sensitivity. The beneficial effects of omega-3 fatty acids generally were not observed in the behavior of the child, so those positive effects did not translate to modifications in child behavior during free play. However, we see some interesting results regarding infant activity and maternal BMI, ADHD, and tumor necrosis factor alpha. Though not directly related to infant and child mental health, there are a couple interesting relationships here. Mothers with ADHD demonstrated higher BMIs and higher levels of TNF alpha. We also see that their children demonstrated reduced physical activity at a very early age. There's a heritable component to ADHD, and while one might expect that children with ADHD would be more physically active, they're actually at higher risk for childhood obesity. And exposure to low-grade systemic inflammation during metabolic programming may underlie this correlation. Collectively, these results suggest that omega-3 fatty acid consumption and fatty acid supplementation during pregnancy may attenuate the potential effects of inflammation and contribute to more optimal maternal mental health and behavior in the postpartum period.